Onchocerciasis, commonly known as river blindness, is a neglected tropical disease. It affects millions of people worldwide. This debilitating disease can cause severe itching, disfigurement, and even blindness. The good news is that it is preventable and treatable. River blindness is caused by a parasitic worm called Onchocerca volvulus. This worm lives in the human body. It is transmitted through the bites of infected black flies. These flies breed in fast-flowing rivers and streams. Hence, the name river blindness. The impact of onchocerciasis extends beyond physical suffering. It traps individuals, families, and entire communities in a cycle of poverty. It hinders economic development. Understanding this complex disease is crucial. We need to support efforts to eliminate this public health menace. Let's delve into the intricacies of onchocerciasis. We will explore its symptoms, diagnosis, treatment, and the ongoing fight to eradicate it. The story of onchocerciasis begins with a tiny thread-like parasite called Onchocerca volvulus. This parasitic worm has a complex life cycle involving both humans and black flies. When an infected black fly bites a human, it injects larval worms into the bloodstream. These larvae migrate through the body and mature into adult worms and subcutaneous nodules. Female worms release thousands of microfilariae, which circulate in the bloodstream. Another black fly can pick them up during a blood meal, continuing the cycle. The symptoms of onchocerciasis can be varied and debilitating. Skin manifestations are often the first noticeable signs of infection. One of the most common skin symptoms is intense itching, known as pruritus. This itching is caused by the movement of microfilaria in the skin. It can be so severe that it disrupts sleep and daily activities.
The itching was unbearable. I couldn't sleep or focus on my work.
Another characteristic skin lesion is the leopard skin appearance. This is characterized by areas of skin depigmentation. Recognizing these early skin symptoms is crucial for prompt diagnosis and treatment. While skin manifestations can be distressing, the most feared complication of onchocerciasis is blindness. The ocular effects of this disease are a result of the inflammatory response to the parasite in the eye. Microfilariae can migrate to the cornea, the clear front part of the eye. This can cause inflammation, scarring, and clouding of vision. Over time, this can lead to impaired vision and eventually blindness. Another serious ocular manifestation is optic nerve atrophy. This occurs when the optic nerve, which transmits visual information from the eye to the brain, is damaged. Optic nerve atrophy can result in permanent vision loss. The impact of blindness on individuals, families, and communities is profound. It can lead to loss of independence, reduced economic opportunities, and social isolation. Early detection and treatment of ocular onchocerciasis are crucial to prevent irreversible vision loss. Section 5. Beyond the surface. Systemic effects of onchocerciasis. While skin and eye problems are the most visible manifestations of onchocerciasis, the disease can also have systemic effects. These effects can impact overall health and well-being. Long-term infection with Onchocerca volvulus can weaken the immune system. This makes individuals more susceptible to other infections. It can also exacerbate existing health conditions. Some people with onchocerciasis develop subcutaneous nodules. These nodules are firm, movable lumps under the skin. While these nodules are usually painless, they can be cosmetically disfiguring. In rare cases, microfilaria can invade the central nervous system. This can lead to neurological complications such as epilepsy and cognitive impairment. The systemic effects of onchocerciasis highlight the complex interplay between the parasite and the human host. It emphasizes the importance of a comprehensive approach to diagnosis and management. Section 6. Unmasking the enemy. Diagnosing onchocerciasis. Diagnosing onchocerciasis relies on a combination of clinical evaluation, laboratory tests, and ocular examination. Early diagnosis is crucial for initiating treatment and preventing complications. A thorough medical history and physical examination are essential. This includes asking about potential exposure to black flies in endemic areas. It also involves examining the skin for characteristic lesions and nodules. Section 7. Fighting back, treatment and management of river blindness. The treatment of onchocerciasis has advanced significantly in recent years. It primarily focuses on eliminating the parasite and managing the symptoms. The drug of choice for treating onchocerciasis is ivermectin. It is a highly effective medication that kills the microfilaria circulating in the body. Ivermectin is typically administered as a single oral dose and repeated annually or semi-annually. In some cases, doxycycline, an antibiotic, may be used in combination with ivermectin. Doxycycline targets the symbiotic bacteria that live inside the adult worms, weakening and killing them. Symptom management is also an essential part of onchocerciasis care. It includes addressing the intense itching with antihistamines or topical corticosteroids. Surgical removal of subcutaneous nodules may be considered for cosmetic reasons or if they are causing discomfort. The availability of effective treatment options has revolutionized the fight against river blindness. It offers hope for a brighter future for those affected by this debilitating disease. Section 8. Breaking the Cycle Prevention and Control Strategies. Preventing and controlling onchocerciasis requires a multi-pronged approach that targets both the parasite and the vector. These strategies aim to interrupt transmission and reduce the burden of disease.
Vector control is a cornerstone of onchocerciasis prevention. This involves reducing the population of black flies through insecticide spraying. It also includes using personal protection measures like insect repellents and protective clothing.
Community-based treatment with ivermectin is highly effective in reducing the prevalence and transmission of the disease. Mass drug administration campaigns where eligible individuals in endemic areas are treated have been instrumental in controlling onchocerciasis.
Health education plays a vital role in prevention. It empowers communities to understand the disease, its transmission, and how to protect themselves. It also promotes early diagnosis and treatment-seeking behavior.
By combining these strategies, we can break the cycle of transmission and move closer to eliminating onchocerciasis. Section 9. A Global Perspective, Epidemiology and Public Health Impact. Onchocerciasis is a disease of poverty. It predominantly affects people living in remote rural areas of sub-Saharan Africa, with smaller foci in Latin America and Yemen.
The World Health Organization estimates that over 20 million people are infected with onchocerciasis. More than 120 million people are at risk of infection. The disease has a significant impact on public health and socioeconomic development.
The economic burden of onchocerciasis is substantial. It results in lost productivity, increased healthcare costs, and reduced tourism. The disease perpetuates the cycle of poverty in affected communities.
Addressing onchocerciasis requires a global commitment to providing resources, strengthening healthcare systems, and supporting research and development. By working together, we can alleviate the suffering caused by this neglected tropical disease and improve the lives of millions of people.
Section 10. Living with onchocerciasis, psychosocial and economic consequences. The impact of onchocerciasis extends far beyond physical health. It has profound psychosocial and economic consequences for individuals, families, and communities. The intense itching and skin disfigurement associated with onchocerciasis can lead to social stigma and discrimination. Affected individuals may experience isolation, shame, and mental distress. Blindness, a devastating consequence of onchocerciasis, has far-reaching implications. It can result in loss of independence, reduced employment opportunities, and increased dependence on others for care. The economic burden of the disease can be overwhelming for families already struggling with poverty. The costs of treatment, transportation, and lost income can push families further into hardship. Addressing the psychosocial and economic impact of onchocerciasis is crucial for holistic care. It requires providing support, counseling, and economic empowerment opportunities. Section 11. The Final Push, Elimination Efforts and a Brighter Future. Despite the challenges, significant progress has been made in the fight against onchocerciasis. Concerted global efforts led by the World Health Organization aim to eliminate the disease as a public health problem.
Mass drug administration with ivermectin has been highly successful in reducing the prevalence and transmission of onchocerciasis. Continued commitment to these programs is essential for sustaining progress.
Research and development efforts are ongoing to develop new tools and strategies for onchocerciasis control. This includes exploring novel drugs, vaccines, and vector control methods.
The global community has set ambitious goals to eliminate onchocerciasis in most endemic countries by 2030. Achieving this goal requires sustained political will, financial investment, and community engagement.
With unwavering dedication and collaborative action, we can eliminate onchocerciasis and create a brighter future for generations to come.